I just first want to say thank you very much to, I think, Rescue Rehab for having a fabulous event again for everyone to get together. I think there's something all of us learn every day. But thank you to Ronald, Dave, the crew. Very well done and fantastic event. My topic today is pet population management. And it's not just the general sterilisation of animals, it's about projects that we run, specifically City of Cape Town, I think is the only municipality actually in South Africa that funds mass sterilisation. African Tales that I was with, absolutely, that's their main focus. Dr. Annelies Roos goes out to very remote areas from CVC. But to do a mass sterilisation, and when people hear that an organisation does that, a big thing is, well, we've had calls from Mitchell's Plain, Gugulethu, this area needs to be cleaned up. It takes a bit more than that. I think most areas in South Africa need quite a huge intervention. But what I'm talking about today is just how you go ahead when planning something like that, and some of the factors that impact that you have to take into account well before even trying to implement a mass sterilisation program. So to start off, where did I go wrong? So components of a comprehensive program, and each of these are just the main points that I'm going to be talking about, is the initial data collection and the assessment, very important. There's various factors that will influence a pet population program. Then there's also various components to it. One big one, obviously, education. You need to design the intervention very, very carefully, including your resources to that. And then very, very important implementation, but then also monitoring and evaluation of a project. So what is the impact of that project? Are we actually making a difference? So when you're collecting your data, and I'd like to, because when the project was started, and Alma and Lauren and Tanya are here, they're still busy with this project. With this, I'm going to use, there's a project currently going in Mumray, that's quite an isolated town, semi-rural, outside of Atlantis. And this is sort of just the skeleton of how you approach when you actually go into an area like this and say you want to do mass sterilisation, what do you want to achieve and how do you go about it? So the first thing is to see what the current estimated size of a pet population is, where the animals are coming from, what welfare problems the animals face, what problems do they cause to the community. That's always a huge concern. That's where you start seeing the real abuse, the neglect, is when there are problems, and that includes, when June speaks, feral colonies, especially feral colonies. Then what is currently being done? Is there another welfare organisation working in that area? Is there some program going already? Is there welfare veterinary services? Is there a mobile clinic going in? And then also very important, who are the stakeholders. When you go into an area, you can't just go in there and start saying, well, now I'm going to sterilise all the animals here. There's the veterinary community, you communicate with them. There are private vets, some of them see it as taking business away from them, but if you work with them, it can actually have a huge impact. There's sometimes NGOs in that community as well, and it's not always animal welfare NGOs. It could also be in terms of humans, but they're good to partner with. Educators, including schools. And then obviously within your structure that you take in there, the educational part is extremely important. Community leaders and representatives, they can be very influential. When we work in Khayelitsha, there's the KDF, which is the Khayelitsha Development Forum. They basically, sorry, I shouldn't really say that, but they run Khayelitsha, and it's almost like the mob of Khayelitsha, and until we had buy-in from them, we actually couldn't work in that community. And then the local community members. So to the first point, to estimate the size of the pet population. So we have a lot of requests. Please come into Mitchell's Plain. There's overpopulation. Now, Dr. Annelies Roos that I mentioned, she's a very good sounding board. She's an expert on this. What is pet overpopulation? So we use that term quite loosely, but what does it mean that we've actually got a situation of pet overpopulation? It's interesting, if you look at South Africa, yes, stats now show from the NSPCA that over 1 million animals are euthanized. It's probably more because not everyone supplies the stats. But if you look in context of somewhere like India, it's a very different scenario. They are overpopulated. They've got a lot of absolutely street feral dogs. And there's quite an interesting connection there with a society's how humane and how much empathy they show, and usually those are the countries where you're actually going to have overpopulation. So in countries where there isn't much respect and empathy and compassion for animals, you usually find you don't actually sit with that situation. In India, everyone feeds those stray animals, and they're making a stronger population to actually breed. But so to estimate the number, so when we went into Mumray, there's various methods, and there are some exceptionally complicated where it becomes formulas that I think scientists would need to decipher. But one of the simpler ways, especially in a smaller area, is to take a target area, a sample area, so you can take 2 or 3 roads, you count the animals, you go house to house. You then get stats from, there's various sources, but the best one is SA Stats, statistics that do our census, so they can tell you there's so many households in this community. Mumray is an example. They've got 2,500 households, but this as an example, you'll take, if you visited 100 houses, or there's 100 houses and you visited 20 and you counted 50 in 20 of those houses, you do the calculation, you can estimate there's a total of 250 animals in 100 households. That's just a very simple example, but there's enough literature on it to go see, how you calculate your estimate. And that is your starting point, because that will drive your funding, it will drive your manpower, and it will determine how big the job is and whether you can actually reach it. Just the first basic principle of pet population management as well. When you go into an area, and this has been internationally researched and documented, ideally what you want to do is sterilize 70% of the breeding, unsterilized animals within a 6-month breeding cycle. That has been shown to actually keep down the numbers and get the pet population under control. Where the animals are coming from, this is important. And each area, each country, each province, this will differ. So it's very area specific. You've got your confined or controlled animals, and those are usually your owned animals. And you've got your roaming animals. Now in South Africa, we're quite unique. There are many feral populations of dogs and cats all over the world. We have a different scenario when you've worked in the townships in the underprivileged areas. There's a lot of community-owned dogs. They don't have an individual owner, but they are community animals, and if you actually go in and even touch an animal, they will quickly tell you it is a community animal, and they're sometimes very well looked after. But so you'll have your owned animals, and then the ones that are roaming and sort of uncontrolled, and those could be owned animals that are lost, and we all see those moving. There's owned animals that are abandoned, owned animals that are roaming, and that's your sort of community animals, and then unowned animals, which are animals born under crates or the street animals that actually give birth, and those animals end up not belonging to anyone. The problems that animals face, we usually, and again, there's models to run these. You can assess what is the intervention, what you want to achieve. So again, an example with Mumray was that initially when we started there was definitely a distemper outbreak. There were a lot of animals, the first few animals we saw were being burnt. The way of taking care of stray animals, fighting dogs, feral cats especially, was to burn them with either hot oil or hot water. So these are the things that come on, and that's where the education becomes very important. So one of the main things for us was to address why are they burning the animals, and to educate them that that is not going to solve the problem. And you base it on the 5 freedoms, obviously. Another big problem in a town like Mumray, we saw it in Khayelitsha, we saw it in Atlantis, is obviously tethering of animals, insufficient shelter. So all the 5 freedoms usually you'll find, but there will be certain ones you want to place the highlights on. What the problems that the animals cause, what people perceive it to be and what the actual problem is can differ. In KwaZulu-Natal, there will probably be the problem of rabies. Rabies we don't have in Western Cape, but there you might find that suits the community, that's a perceived problem. And we say real or perceived. Some people perceive something to be a problem, and it's not really. And what is being done to control that pet population? So for instance, in a town like Mumray, there'd been some work but not a lot. There are mobile clinics that go in. There is a private vet that offers welfare veterinary services, but it was case by case. So it wasn't going in there and actually saying, let's do mass 70% within a given time frame. And there again, to consider and prioritize factors affecting the pet population size, it's often the human attitudes and behaviours. So again, the beliefs, my dog should have one litter. There are often, it is also cultural and religious, factors that do affect us very much. Responsible pet ownership, as I said, local beliefs and attitude, religion and culture. Then again, reproductive capacity, unowned, owned, and breeders. Your unowned animals run around. They are not in enclosed property, so obviously they pose the biggest problem. Then your owned animals, they again, though, sometimes even a bigger problem because people believe they should breed. We all know pit bulls are a problem. In my memory, sort of German shepherds, Cocker Spaniels, actually thoroughbred animals that they're breeding with, and in very unacceptable environments. And then also accesses to resources. So a lot of the feral animals, I'm sure June will speak about that in her presentation, but if you look at feral or street animals, usually you're going to find, we get calls from factories, we get calls from industrial areas. Where there is food, there's rubbish or deliberate feeding in parks. It's quite interesting. You're going to find that those animals start migrating and start actually becoming colonies within those areas where they've got access to survive. Factors that motivate animal control. This is in terms of governments, in terms of municipal structures, in terms of communities. The biggest things that would motivate them to want to control how many animals there are and where those animals are coming from and where they're moving is zoonotic diseases. Does everyone here know what that is? That is just a disease transferable between human and animal. So whether it be rabies, like in KwaZulu-Natal especially, worms, mange, ticks, fleas, various diseases. Then also injuries and bites, that seems to be quite a big problem in these communities. Pollution, where they are scratching through bins and tossing bins, and then also motor vehicle accidents. And there that goes further to Mumra. Big problem also is the horses and the ponies, and it causes the cost to the taxpayer is actually a huge amount, and obviously also for the animals it's a risk. So then the components, so you have to look at, once you've got that data and you decide you're going to go ahead, this is a population size, you've got enough funding to do 70% of this population, you need to have some components that are, it's a non-negotiable, it has to be part of it. That is in education. Tanya from Four Paws, African Tales, actually partnered with them. She picks up the educational part, Four Paws, going into schools, going into creches, going into the ladies' church groups, educating, getting the word out. You need to look at the legislation. What are your rights in terms of going in there? What can you enforce and what can you not enforce? Certain areas have got different bylaws. We haven't got compulsory sterilisation yet. However, I do believe it's coming soon and later, and we're currently having discussions with the City of Cape Town to review bylaws. Records, database is your most, a very important one as well. Then the actual sterilisation, you have to look at your homing facilities and rehoming, your policies, procedures. If there's animals not wanted, stray animals, who do you keep, who do you rehome, and unfortunately, who do you need to euthanize? If there is euthanasia, because of whether it is disease, illness, the first few weeks or months we worked there, the rabies, the distemper outbreak was so severe that we actually had to attend to that first because animals were suffering because of that. So euthanasia is treat the symptoms, not the causes. Vaccination and treatments, rabies, you also have to make this comprehensive. You can't just go in and sterilise animals. With the City of Cape Town as well, they give money towards only the actual surgical part of it. There are additional costs you need to work it in. Every animal should be vaccinated against rabies. Any animal under the age of 12 months should get a core vaccination, plus probably a booster. There needs to be endo and ectoparasite control, so for worms, ticks, fleas. Animals do come in with injuries, animals do come in with mange, and there's always extras that go with it. So you can't just do a calculation, budget for more, because there are additional costs. Some of these animals do need to be fed, some need follow-ups. You've got your manpower, you have to cover fuel, so there's various indirect costs as well. And then controlling access to resources, that is looking at in that environment how you can change things so that there aren't rubbish dumps, so that people aren't just feeding animals at certain areas without it being controlled. You design it, you need to look at, as I said, your financial, your manpower, your main objectives. Those are the ones from the 5 freedoms. What do you want to achieve, and how you're going to actually measure what you have achieved. I'll go into that more detail. You have to have certain standards that are not negotiable. It's not in the best interest of an animal to go in there, not handle them properly, not keep them in a clean environment, not feed them. That is not good animal practice. I always say to people, remember, when you're going in there, you are setting an example to owners there as well, from the handling of that animal to the transport to how you keep that animal and treat that animal. That is probably the biggest. They are learning from you with what you're showing them, how you deal with those animals. Surgery has to be obviously aseptic. It needs to be a registered vet, and that uses the proper drugs. Handling and transport, housing and husbandry. Have the rehoming procedures in place, and have in place, because the things get very heated, and we know it, most of us work in welfare. When do you euthanize, when not? None of us like doing it. So have clear guidelines as to when is that your only option. And then record keeping, you need to keep data of all that information that you gather. Keep it on a database, and that will become your source where you can analyze the data from. So the implementation, you prioritize all the above. You use a pilot area in that area. In Mumra, we started at the bottom, which was actually what they call the informal scheme. So that is sort of your informal housing, not formal structures, probably your poorer part of the community. And that will give you an indication of what you face, and starts giving you more data to also estimate much better what the size of the population is. The more houses you start visiting, you can actually start seeing what that population size is. The monitoring and evaluation, this is sort of at the end of it as you go along as well. So it's important as you go along that you start highlighting the problems and successes. As you go along, you fine-tune this program. We started off with thinking this is how we're going to do it, and every time you readjust a bit because you're hitting certain snags. Come winter, it's cold for the animals, they're not recovering well. There was a rabies outbreak. You can't start taking animals and a week later they die, and people think it's because they're sterilized, and actually it's an underlying problem. So you need to look at those things and readjust your plans as you go ahead. And that data becomes quite important going forward to motivate and to ask for more funding for supporters based on if you can demonstrate what your achievements actually have been. Then also you need to agree if you're partnering, but also with the vets and within a team, what the standards are, the process, the protocols, in terms of everything. Euthanasia, vaccination, that everyone is on the same page. Monitoring, continuous process to check the program is going according to the plan, and that's what I was talking about. Adjust when necessary, and that is, it's like any project. As you go along, you assess it, and some things need to change, some things need to improve, and some things actually need to be done completely differently. The evaluation, that is periodic, so we would do sort of quarterly, we'd evaluate, we'd have a target of about 400 animals, evaluate how it did, what the outcomes were, and then check the impact, and that can be used to say, okay, going forward within that project or another project, how do we go forward in terms of funding and resourcing and actually running the project. And there again, the monitoring and the evaluation, and I'll show you a little graph now how you get to that. You need to decide that up front, that everyone's on the same page, to say we're going to monitor and we're going to evaluate based on these factors, So that there's no misconception that is, well, if we've done 1,000 animals, we're okay. No, we agreed that if we do 70% of 2,000 animals, that is what our target is, and that's what we need to achieve. So just an example of monitoring and evaluation. You basically have your objective, and this was one. So in this project, we had that we wanted to have sterilizations, sterilize 70% of the population. The second objective was to actually improve animal welfare. The third objective was education, and the fourth was actually sustainability. So there were only 4 objectives, and each one had a table like this. Just what I mentioned, sustainability, very important. You must also remember when you go into a community and you go and you sterilize 70% of the animals, you can't pack up, move out, and forget about that community sitting there. You need to have structures in place, and we've actually got some of the Mumray community members here today that became an integral part of the volunteering. They're actually part of the community. They're the eyes and the ears. And once the project is finalized, they will be the eyes and ears. They've got certain resources that they've got that they can turn to actually assist those animals when the welfare isn't there anymore. And the project has been finished. So you've got an impact and a goal. I don't know if you just want to have a look at it. And we just said, so the first one, the impact and the, has this got a pointer? Okay, that's fine. So the first one that impacts the goal, that just reflects the change created by the project. So we're saying to improve animal welfare, you want good physical and emotional well-being, and then you put in indicators. Physical indicators would be the body condition. How many animals are tethered? Have they got food and water? And all of those things are on the form, and you keep records of that data, and you can then start seeing, so if you go back in 2 years' time, you can say, these animals at these addresses were in this condition. When we're going back now, this intervention, they are no longer tied up. They have got food, they have got shelter. You can actually say what impact not only the sterilisation, the education, and the rest of the intervention has actually achieved. And then there's just a way of how you actually get that information, which is on the right. So you take the data, you record it, you analyze it, you can see how many animals are now being brought by owners to be vaccinated, to be sterilized. And again, you can go back on 100 animals, say previously they didn't have water, shelter, they were tied, they had mange, the owners didn't take the vaccination. You can go back and say 2 years later, the intervention we had with education, with sterilisation, for them to take responsibility. They're now doing it, so we can quite safely say it has been a positive intervention. So there's various, and then, so you've got an outcome and a purpose, which is to improve animal welfare, and then it goes to the output, and all of these are available. I'll maybe add it for when Renal puts out the slideshow with some links where you can go onto. A lot of these models, and again, Dr. Riyaaz and I went on the conference, and we're going this year again. There's ICAM and I4. They are the world leaders in mass sterilisation. Go have a look at their website. They've got fantastic user guides, links, things where you can actually go and tag with a GPS location, take a photo to keep a database of animals. So there's very good resources sitting to do these sort of projects. And then just the activities actually says what you need to do to achieve that. So for instance, source funding, supply the educational interventions material, and then medically treat and vaccinate animals. And there again, you'll go at the indicator is how many funds did you get in, what are the effective educational interventions, then again also, is there less neglect, abuse, and overall better care? And then how you will get to the one at the bottom is just the agreements with your partners, surveys, and stats. I hope that has made sense to everyone, because that's very much mass sterilisation that can take months and months to plan in a nutshell. Are there questions? That's fine. Any questions? Yes, Amy.
What were the websites?
If you put in ICAM, which is the International Coalition for Animal Management, I think it is, and then I4. And if you actually put in, it falls for them under pet population management. There are so many documents and guidelines, and actually they've got the surveys there already that you can take to do with owners. So there's a lot of educational material there and resources that you can tap into.
How do you deal with owners that are reticent about the sterilisation? We have that a lot in Dunham Park, and then we have people that promise to come. They fill the form, sign the thing. We SMS them the week before, we SMS them the night before, then they don't come. Then we try driving around to find the animals that are supposed to come. So we have quite a big no-show rate, even though it's being done free. I find there's a reticence. They feel like, well, there's not anything in it for them. I mean, if you said you got a free beer, I think they'd come, but it's like that. You know.
I think, so do you actually sign them up and they have to come to the venue?
Correct, but it's within walking distance. I mean, it's in the town hall in the township.
It's, unfortunately, I think the mentality is you have to do it all. So for instance, the projects we run, we literally go house to house, sign it up, look at the animal, drive there, pick it up in the morning, load it.
You have that same problem.
There's nothing you can do. I think what we do find works is if there's a little bit of a sweetness. So we do say you're going to get, it's amazing little things in these projects. So an owner to get a vaccination booklet, it gives them a sense of there's an importance to this animal. If you told them what you're offering, that you're giving that animal, that at a private vet, and I found this works over and over, and I'm sure Alma, Tanya, and Lawrence in here can say the same. You say to them, what we are offering you, you would pay at a private vet 2,000 Rand for the vaccination, you'd pay 500 Rand. If you start putting out to them what the actual monetary value is, and then you say, and another very big, I think, bargaining tool is when you start speaking about zoonosis. So if you say to them, remember, your children can get sick from this, you can pick up illnesses. Those are things that really help that can convince owners, and we've seen that work a lot. Yeah. Sorry, just in terms of also, besides the booklet, what we do with most of them is we promise a food parcel, and that's and then another thing that we did, and that was sort of a very big bargaining tool, it seems, is any dog that comes back to your resourcing and upfront, so to get your donors in place, was we had a very, very generous donor that would give 50 kennels at a time, buy it at 50,000 Rand or more, and that became a very big bargaining tool. It was a kennel, funny enough.
That's amazing. We don't have those.
No, but there are other, and it's not, and we couldn't always tap into those resources either. But I think if you spell out what the benefit and the monetary value is, it sways people.
Thank you for that.
Sorry, I just wanted to add to that. We also found that free vaccination cards made a huge difference, but we also gave away collars to each dog that was sterilised. And we started off the day with people being really reluctant, but when they realised they were getting free stuff, we had the maximum. So the collar was like they were really chuffed. The dog came on the chain and the collar. So that made a big difference. And we made them ourselves. They cost 5 Rand.
Yeah, it's little things that make a difference. Yeah. Anything else? Okay. Well, this is going to be it. Oh, you've got it up. Okay. Thank you. Okay, so the next topic, and I'm sure most of us have heard this song many times over, and I see lots of fights on Facebook about this and lots of comments, but I think it's something so important. And I think just to mention as well, and I think Karen that spoke early on touched on this, I think as an animal welfare community, we must remember that anything any of us does is a reflection on every single organization. So you can't go out there and create this perception, and I come from a corporate background, and then you think that animal welfare are these lot of crazy people running around, and you see these fights between them on Facebook. It's not done. However, I do think there are ways to address it, and we all, as I say, learn something every day. In terms of responsible rescue and rehoming, I think this is the biggest thing where there's friction. There are some things I think that are just critical that you cannot overlook, and you have to do. So this is going to be probably a 5-minute presentation, but So for responsible rescue and rehoming, so I started off my career in welfare in adoptions with the Animal Anti-Cruelty League, which is very much the same as the SPCA. So I have seen both sides of the coin. I've worked in a shelter that is not allowed to turn away an animal, that can't say they're a no-kill shelter, because they may not turn away an animal. And if you've got a capacity to keep so many animals, if you've got 20 cages, you don't have a choice. It's not an easy job. Alma and Lauren come from that background as well, and so we must also be careful to point fingers at the organisations that don't have a choice. Those staff do battle, they have their challenges, they've got compassion fatigue, but they cannot say, sorry, we're full. They legally have to take that animal according to our constitution. Available to staff, volunteers, if you've got fosters, and to the public for anyone wanting to adopt. And make sure, you know, we all assume what we know everyone knows. They don't. Make sure that your staff, again, all the employees, volunteers, fosters, your publics, the people that want to adopt, that they understand what those policies are. The documentation, you have to have sort of a pre-adoption questionnaire. I think when you've done it long enough, you know exactly which questions to ask. But we all know there's people coming in and out, or you might have volunteers or fosters that get asked those questions. Make sure they know what it is. So when someone wants to adopt an animal, make sure you've got questions that you are going to ask. And we'll go into slight detail on that. Have an application form, and very importantly, have a contract in place. It's not just a form. You need to contractually put in writing what the conditions are of you letting that animal go to that home, and what the conditions are if they can no longer keep them, if the animal is sick, that they may not breed. All those types of things is actually a legal document. Explain to me what the adoption fees, it differs amongst welfare. Certain of us have different resources. Some include vaccination. I do believe you shouldn't be adopting an animal without the first vaccination, at least 2 weeks after that. As we all know, Parva December has got an incubation period of about 14 days. So if an animal comes in today and you send it on in a week's time, there is a possibility someone's heart is going to be broken because it takes 14 days for December or Parvo to actually, you know, surface. So rather vaccinate, obviously have the animal have a health check, vaccinate, give it 2 weeks, and then start looking at adopting, obviously depending on the animal's age. So explain to people what the fee that they're paying, what it covers. Generally, it covers vaccination, sterilisation, microchipping, but that's what I say it differs from organisation. So there are some that do not include sterilisation. There, very importantly, make sure contractually as well that the adopter knows that, and that you have got a right to enforce that when that animal is 6 months old. Obviously, even before the animal goes off, have a database. When did they come in? When were they vaccinated? They might not go out before the next vaccination is due, or sterilisation, so you need to monitor every single animal, that everything is done for that animal. Thank you. Interview and matching, very important. There's the animal. You need to see what is the animal, what is the animal's age, what is the breed, what is the temperament. And always with puppies, you don't know what the temperament's going to be. How's that animal with other animals? How's its health? Does it need extra grooming? What's its energy level? And then any special needs. And be honest. If there are special needs, if there are things that you know that is with this animal is going to maybe not be for everyone. Rather tell people there are people that take on animals, but rather than place an animal and comes back just because you haven't given all the information. The adopter, very important, lifestyle. Current and previous animals can tell you a lot about someone. If you start asking the right questions. Now, I've never had a dog. Okay, but you'll have to have a kennel. Now, I've got a kennel. So why do you have a kennel? Because I actually did have a dog. Ask lots of questions, do an interview, get a lot of information. The age obviously needs to be 18 or older to be able to adopt, and even there again at 20, you know, and no disrespect, but if you're 20 years old, you might still be going overseas, you might still go study, you're going to get married and have, so be very careful about the age and you know, the security of that family. Children under the age of 6 years, I do not suggest no small animals to them, and even if it's an adult animal, a poodle or a Jack Russell, there's certain breeds with children. Be very careful when homing to to families with children under 6, and even, I would even say under 8 years. Generally we say 6 years, but younger children, it's always just a red flag. And it's a risk to the animal and also to the child, and then also actually to your organization. Have they got allergies? We all hear that one. And then current and previous animals. Also take into account the bylaws. Don't go rehome to someone that's got 6 or 7 animals already. You give them another one, and when law enforcement knocks on their doors, the neighbors moan, your animal's going to come back. Stick to what our bylaws say. It just makes it a bit cleaner. And get vets or references on that person. Vets, if they have had animals before, vets can give references. The reason for adoption, it must be a companion, not mainly as a guard dog, not, most of us say not sleep outside, and not as gifts. I think all of us sitting here read enough on social media about that. Property check, is it owned? Do they rent? Is it a complex? Do they need permission from the landlord? Do they need body corporate permission? A lot of people come back and say no, and we've seen it. 6 months down the line, they came back and said, oh no, I didn't know, I wasn't allowed to, and it's not true. If it is not owned, get permission from whoever they're renting from or from a body corporate. Obviously the size of the property, security, wall height. For cats, are there electric fencing? Is there barbed wire? Swimming pool, very important for little dogs, and obviously for young animals as well. It should just be no, unless you have a pool net up or a fence around that pool. I have seen where a lot of heartache has been caused, and you think we'll take the chance about we'll grow up, and they say we watch it the whole time. It takes literally 2 minutes. And contract, make sure they may not sell it, they may not breed, fight, tear them. Those are very important things for make sure they must be able to give that animal the medical care. So for instance, some organizations ask, what is your income? And I think it's a valid question to ask. Some people take exception, some don't. But if you have an after hours emergency now and you put your foot into a private vet, they ask you for 2,000 rand. So think about that as well. Owner must inform the animal welfare organization if the animal goes missing or if it dies, and must return to the animal welfare organization if they can no longer keep the animal. And then of course the animal has to be sterilized. If too young when it goes out, at 6 months. Sometimes that is negotiable if the animal, especially big breed dogs now, there is research showing it's not best at 6 months. If it's a responsible home, obviously you can negotiate that. Follow up always, go back. Don't just send the animal out and never go back. Make sure the vaccinations will be done, sterilization, microchip, that the animal is still in the same conditions, goes back to my example of up in Cluttercliff. Give them resources on which vets they can go to, training, behaviorists, where they can, that cuts off, food, was that man. And then how to increase adoption. We all see, and I think as many people start commenting, you see the same picture, another dog, and you just scroll past. Try and be creative, be professional. Don't pressure people. Don't do on the spot adoptions. We have seen over and over, we have adoption days, and people, we are convinced that animals are going home. They have a cooling off, like when you buy a house, and by the next day they say, sorry, they actually don't think so. And so rather don't do on the spot adoptions. Let them spend time with the animal and give the full history, and be honest if the animal has special needs. And that is spot on 45 minutes.